This morning, I woke up and checked my phone. I turned off my alarm, scrolled through Twitter to glean my daily dose of news and humor, and shared a viral video with my colleagues who are working remotely from all around the country. Before getting dressed, I called out to my dear friend, "Hey Alexa, what's the weather like today?" And she replied that I should expect mid 70s, partly cloudy. I trust her, and the forecast turned out to be accurate. I spent the next few hours on my computer, living my digital life while the COVID-19 pandemic rages on outside of my apartment. I imagine your routine is somewhat similar, with the tension bouncing from your cell phone to your computer and conversing with others using these technologies. Wherever we are in the country or in the world, we are bound by the internet and connected through our engagements on platforms that the internet makes possible. Hi, I'm Kathleen Bevan, and after telling you all about my daily routine, I should also mention that I'm a third-year student at Duke University studying biology and public policy, specifically cybersecurity and health data policy. And lately I've been wondering, what if, in addition to predicting the next viral video, the internet could also be used to predict the next viral outbreak? Over the course of history, US health security has been threatened by a series of infectious disease events. In the past decade, these have included the 2009 influenza outbreak, the emergence of Middle East respiratory syndrome or MERS, the Ebola outbreak, the rapid spread of Zika virus, and of course, the current COVID-19 pandemic. Testing, tracking, and the value of integrated systems for health data have become common topics in today's world. As the ongoing US response to COVID-19 illustrates, delays in detecting and responding to outbreaks exacerbate their human and economic tolls. The continued challenge that the United States faces in detecting and responding to infectious disease threats should encourage a close analysis of our current capabilities and spur action towards much needed sustainable improvements. This will not be our last pandemic, but it can serve as a wake-up call. While we may not be able to prevent future outbreaks, we can mitigate their effects by utilizing existing technology infrastructure to its full potential to develop better biosurveillance tools and data integration capacities. We can be better equipped to detect the next pandemic, or even prevent it from happening at all. Biosurveillance, governing for a threat without borders. The world cannot eliminate disease. The majority of emerging infectious diseases are zoonotic diseases: HIV, Ebola, Lyme's disease, and of course, the novel coronavirus, all of which continue to kill millions. These diseases jump from wild or domestic animals to humans in events termed spillovers. As the global population continues to rise and human activity encroaches even more upon animal habitats, such as through deforestation, wildlife trade, and intensified agriculture, contact with infected animals likewise increases. Our world is more interconnected than it has ever been, making the risk that another disease jumps from animal to people, and then from people to more people, higher than ever. If we want to prevent another COVID-19-like pandemic, we need to catch emerging threats before they spread. That means investing in early detection, early warning, and early response. The way to do this is through biosurveillance. To start off, what is biosurveillance? In a health-specific context, biosurveillance for public health generally refers to the continued monitoring of information sources for the purposes of detecting and managing an outbreak or other public health event, whether naturally occurring or deliberate. The goal of gathering, integrating, interpreting, and communicating essential information related to hazardous threats or disease activity is to provide situational awareness and an understanding of what is going on with respect to the occurrence of biological threats, and guide efforts to control them. Biosurveillance systems may gather and analyze data from a variety of human, animal, plant, and environmental health sources. This field entails 4 basic functions: detecting and reporting cases of disease in specific populations, analyzing and confirming reported care information to detect outbreaks, providing suitable responses at the local and national level, and providing sustained intelligence for the management of epidemiological activity. The methods used to monitor and detect outbreaks can be broken up into 3 primary categories. Laboratory surveillance occurs by seeking red flags in laboratory data, by facilitating an interconnected network of partner laboratories equipped to respond to disease outbreaks and other public health emergencies. Environmental surveillance is a method of surveillance that samples the air using specialized monitors and detection systems. Syndromic surveillance occurs by monitoring illnesses as they occur in hospitals and clinics, by using data points that include over-the-counter medicine purchases, hotline calls, increases in certain medical complaints and diagnoses, and lately, internet search and posting activity. Now that we've defined what biosurveillance is and the different categories of surveillance, let's turn to the development of biosurveillance capacities in the United States. In the US, priority was placed on developing a biosurveillance strategy following the September 11, 2001 terrorist attacks in New York City and the following anthrax attacks. In 2007, the implementing recommendations of the 9/11 Commission Act created the National Biosurveillance Integration Center within the Department of Homeland Security to identify, integrate, and analyze data to detect biothreats and disseminate alerts. The National Biosurveillance Integration Center was created to realize the goals of the National Biosurveillance Integration System, which was intended to be the nation's first system capable of providing comprehensive and integrated biosurveillance for situational awareness of threat. The 2012 White House National Strategy for Biosurveillance was the first national strategy to call for a coordinated approach to achieve a well-integrated national biosurveillance enterprise. While this was a notable advancement in US biosurveillance, this strategy lacked definitive action items to actually implement its goals. Therefore, audits conducted by the US Government Accountability Office years later in 2017 still identified the US as having weak biothreat detection capacities, which spurred the 2019 Homeland Security Strategy for Integrated Biosurveillance that pointed to specific improvements, such as new datasets, expanded partnerships, and a more effective use of technological mechanisms for data integration. Integrated biosurveillance efforts, including those developed through the National Biosurveillance Integration Center, are meant to tap into federal departments and agencies across all surveillance categories in pursuit of earlier warning and enhanced situational awareness for biological events of national concern. Despite all of these strategies that are meant to enhance cooperation for public health, the United States has shown to be unprepared to weather a biological outbreak. We are a year and a half into a pandemic, with the end still not in sight. The nation is spending millions of dollars each year on systems whose capabilities are suspect at best, and in many cases, simultaneously slow to develop and inefficient when implemented. In practice, the National Biosurveillance Integration Center has suffered from a lack of clear purpose, and many partners refuse to share data with the agency due to a lack of trust and incentive. Raw data streams that would allow analysis of the big picture of public health are still not properly integrated into the system. This rapid sharing of data is critical in detection and response to outbreaks, yet national policies that prohibit data sharing due to concerns about privacy and sovereignty, as well as fragmented and duplicative efforts in biosurveillance systems creation, limit the exchange of information, even in circumstances when it is most needed. We need systems that are more efficient and more accurate to enable us to detect, identify, and respond. Regardless of the political party in power, every iteration of US biosurveillance policy and strategy stated basically the same goal: to increase secure interoperability of data collection, analysis, and sharing of information. At large, this has yet to be realized, even with huge advances in technology that, in theory, should make this simple to enact. At its essence, digital and data governance has been a capacity issue, not a technological one. The US government has not sufficiently leveraged the potential of the technology sector to advance real-time exchange of data to respond to public health emergencies. Advancements in digital tools and computing have largely been driven by the private sector, like Google, Apple, Twitter, to bring specialized expertise to the development of innovations for digital health. Just think about the power harnessed by the screens that we stare at all day. Yet, the sustained engagement of industry to advance US and global health goals is underutilized, and the capabilities of industry and technology are limited without a more effective partnership between the private sector and governments. We are living in non-traditional times, relying on continuously ineffective traditional methods. Harnessing new innovations like the capabilities of digital technologies, big data, and machine learning could help strengthen prevention measures by predicting potential future epidemic outbreaks earlier and targeting communications for behavior change. The internet is now a part of almost everyone's life. Like I mentioned at the beginning of my talk, most of the interactions I had with people today were via the internet. More than 90% of US adults use the internet, and 70% of US adults have a social media account. The ubiquitous and openly accessible information produced by the public on the internet has sparked an increasing interest in developing digital public health surveillance systems. In recent years, internet-based search tools and social media have created exciting new prospects for expanding disease surveillance by capturing real-time data trends for health outcomes. Instead of basing surveillance solely around patients' private health records, like the hospital and laboratory data that traditional surveillance techniques currently rely on, the internet has made new types of syndromic data available, such as social media, search queries, and website logs. Rather than relying on formal official sources, information is received directly from the witnesses of real-time events or indirectly from reports sent through social media posts, established alert systems, and news. Aggregate collection and subsequent algorithmic processing of this publicly sourced data, like to differentiate between having a viral fever versus Bieber fever, is becoming increasingly possible and accurate. This can also happen with much less delay than our current systems, which often silo data collection and lose the big picture amongst bureaucratic gatekeepers. Digital surveillance can capture members of the population who do not come into contact with more traditional medical-based surveillance systems, and can capture events that may be missed by traditional clinic-based surveillance. We are on the precipice of an unprecedented opportunity to track, predict, and prevent global disease burdens in the population using digital data. And to some extent, this is already happening. The US generates around 8 million online searches for health-related information daily. Millions of social media users share information online to augment the growing number of digital news sources which report on disease events. Analysis of digital de-identified data, like Google searches, has been used to monitor disease, mental health, drug use, health policy impact, and health-related behaviors. Informal reporting of epidemics and outbreaks through internet newswires has been demonstrated to be accurate and more timely than official public health agency announcements. There currently exists only one publicly accessible service, a nonprofit called ProMedMail, which has pioneered the concept of electronic internet-based emerging disease and outbreak detection reporting. ProMedMail is an expert-moderated service that uses data mining technology to search for key phrases among official publications, media, and subscribers of the service to report outbreaks of emerging infectious diseases and disseminate them rapidly to over 75,000 people via their website and mailing list. It identified the SARS outbreak, the MERS outbreak, and the COVID-19 outbreak before the WHO and national governments. Early detection was then confirmed by national government-run agencies. Each day, early detection saves thousands of lives. This internet-based surveillance system proves that the ability to make informed inferences based on publicly available big data exists. And it also shows that public participation in outbreak reporting complements official reporting systems in a highly practical, cost-efficient, and life-saving way. A ProMedMail approach would be a highly beneficial complement to existing US disease surveillance systems. What should be stressed is that if the US were to adopt such a model of online and digital surveillance, it should be seen as a complement to existing infrastructure. Although internet-based approaches are logistically and economically appealing, there are already millions of computers in the US and billions worldwide with just as many users willingly sharing that information on public platforms. Digital surveillance should be viewed not as an alternative to existing traditional systems, but rather as an extension. This is critical. Public-private partnership is imperative here. Digital surveillance systems like Google Flu Trends have failed in the past because they have operated solely within the private sector and did not utilize laboratory or clinical data to back their claims before reporting of an outbreak. Such sole use of internet searches and posts about disease or symptoms introduces the main concern of data quality and accuracy. It could elicit over or underreporting of disease prevalence. Government collaboration with the private technology center would not only facilitate faster development of digital surveillance capacities, it would help to navigate trade-offs to ensure that data is used in a de-identified and normalized way to avoid bias and that it is protected to the highest degree. The US government and big tech companies have strengthened their relationship in the battle against COVID, so it's not unreasonable to think that such collaboration is out of reach. Digital surveillance will have the largest public health impact when integrated with traditional surveillance systems, such as traditional laboratory data, case reports, and electronic health records that are already used by agencies like the National Biosurveillance Integration Center. If ground truth against healthcare-based statistics and protected by strict privacy protections, the use of publicly available internet data, like what people are searching for, posting, and reading about, can help to optimize rapid detection of disease, earlier warning and dissemination of information, and rapid response. We need to adopt a model that operates without borders to mitigate threats that do not respect them. Imagine if, in addition to receiving notifications about viral videos, you also received notifications about fact-checked disease reports. In the past, US biosurveillance has been marked by a cycle of panic and neglect, as evidenced by the haphazardly thrown together surveillance groups upon the outbreak of the novel coronavirus. A large part of epidemiological modeling is based on human behavior, which remains largely unpredictable, especially by stagnant traditional systems that do not account for the intricacies of daily life. There is a growing existence of digital and algorithmic ability to parse through public health information that already exists online, which has yet to be realized for its potential in strengthening syndromic surveillance. Newly elected Joe Biden's executive plan includes the stated goal: to improve the United States' preparedness, the administration will work to secure funding and congressional support to establish an integrated national center for epidemic forecasting and outbreak analytics to modernize global early warning and trigger systems to prevent, detect, and respond to biological threats. As of today, it is unclear whether the Biden administration plans will turn into legislation or get funding, but they do present a clear and tangible opportunity to integrate online and digital surveillance with traditional infrastructure. We must remember that technology exists as a tool for humanity, and I can't think of a better way to improve humanity than if we could prevent the next pandemic.